Access to clean water is honestly one of the most basic human rights, isn't it? Yet here we are in a world where more than 2 billion people, yes, 2 billion, don't have that access. Think about that for a second. This isn't just about inconvenience. This is about survival. I mean, we're talking children, thousands of them, dying every single day from diseases like diarrhea, cholera, dysentery, diseases that we, well, could easily prevent. And you saw it in Haiti after the earthquake, didn't you? Entire communities devastated, not just by the disaster itself, but by the ripple effects. Dirty water, no sanitation, and these diseases that just, well, sweep through like wildfire. But it's not just about disasters. It's about these structural inequalities that exist even in wealthier nations, like the United States. Have you heard about those communities in rural Alabama? They don't even have basic sanitation, the kind of systems that we completely take for granted. Open sewage leaves people exposed to all kinds of health risks, and it's shameful, isn't it? And then there's flooding, villages where contamination becomes a constant threat. Clean water gets turned into a breeding ground for microbes, and, well, it's the vulnerable populations who bear the brunt of it. And who are the most vulnerable? It's often women and girls. Can you imagine being a girl in a refugee camp without a secure place to, well, go to the bathroom? The risks they face, harassment, even violence, it's staggering. And it's not just their safety, it's their health, their access to education. I mean, how can they stay in school when they're spending hours every day just fetching water or when their hygiene needs are ignored? It's an endless trap, and the consequences carry over into every part of their lives. This is the reality we're up against, you know. The lack of clean water isn't just about thirst or hygiene or disease. It's tied to dignity, equality, and opportunity. And until we break down these systemic barriers, well, these crises will only deepen further. All right, so let's talk solutions. In emergencies, like in many conflict zones or after disasters, quick, effective technologies can make all the difference, right? Take water bladders, for example. These flexible tanks can store thousands of liters of clean water, often serving entire displaced communities. They're portable, durable, and the water stays pretty uncontaminated. And then there are portable latrines, lightweight, effective ways to maintain hygiene in camps or disaster zones, especially when permanent infrastructure is, well, completely destroyed. We've got chlorination too, simple but brilliant. A tiny tablet that can purify contaminated water, turning it drinkable in minutes. But you know, emergency solutions are just one part of the story. Let's not forget about sustainable investments. Permanent wash interventions, like rehabilitating water systems or constructing proper sewage networks, they might cost more upfront, sure, but they're life changing in the long run. Organizations like UNICEF's WASH programs have shown how these infrastructures not only reduce disease, but also bring massive economic and social benefits. For every dollar spent, communities gain in health outcomes, education opportunities, and livelihoods. I mean, it's not just better, it's transformational, isn't it? And innovation doesn't stop there. Have you heard of wastewater epidemiology? I know it sounds complex, but it's so fascinating. It's like analyzing community sewage to detect disease patterns before outbreaks occur. Imagine being able to prevent a cholera epidemic before it spirals out of control. That's how powerful science can get. And then there are those affordable testing kits, microbial contamination being identified quickly and cost effectively. These tools become game changers, especially in low resource settings. Technology, when used right, can be a bridge between despair and hope. Every one of these solutions, whether for emergencies or long term investments, reminds us that this crisis is solvable. It's not about the lack of resources, it's about channeling them where they're needed most efficiently. And the innovations out there, well, they're proving that change is possible if we stay committed. You know, when we think about water and sanitation, it's easy to focus on infrastructure, the pipes, the taps, the technology. But here's the thing, that's only half the story. Changing behaviors, rooting solutions in cultural contexts, that's where the real work begins. And behavioral science, it holds the key. Using something called the three-term contingency, stay with me here, we can understand behavior change better. It's a cycle, see? Antecedents or triggers influence behaviors, and behaviors are then reinforced by consequences. For instance, if a community relies on untreated water because it's just, well, easier and faster, that ease reinforces the unsafe habit. But if safe water points are made available and rewarded, maybe even through something as simple as, I don't know, a community celebration, it encourages people to shift towards healthier practices. Positive reinforcement isn't just effective, it's empowering. But behavior doesn't exist in a vacuum, does it? Cultural sensitivity. That's non negotiable. Rapid assessments in emergency areas are so vital here. They give us insight into what a community really needs. Like in Kenya, there was that incredible mapping project after flooding in the Proctor Creek watershed. Local residents got involved in identifying problem spots, hazards like broken storm drains or standing water. And because they co created the solutions, the buy in, well, it was immediate. Don't you think that feels so logical? People want their voices heard. It's about respect and understanding. And then there's education. Post disaster hygiene programs don't just save lives, they rebuild dignity. Campaigns that align with local norms, ones that use relatable formats like puppet shows or street theater, those resonate so powerfully. Whether it's explaining safe hand washing through stories or mapping sanitation risks, these methods connect on such a human level. It's about crafting messages that stick and that inspire communities to own the change. Globally, we've got such inspiring examples too. Rajasthan's villages, for instance. For years, these villages faced water scarcity so severe, life itself revolved around survival. But then, community driven conservation techniques emerged, things like step wells and rainwater harvesting. Age old traditions blended with today's science. It's genius, really. It proves that solutions don't need to be imported. They can grow organically right where they're needed. So here's what it all boils down to: behavioral transformation, cultural alignment, and of course, innovation. Yes, the challenges in achieving WASH goals are immense, even daunting, but they're not insurmountable. When we bring science, empathy, and creativity together, the ripple effect, it's unstoppable. And that brings us back to the bigger picture. Safe water, proper sanitation, it's so much more than just health or hygiene. It's hope, it's equality, and it's a future where dignity isn't a privilege, it's a right. On that note, thank you for joining me today and exploring these global challenges. Let's keep the conversation alive because change starts not just with big ideas, but with every effort to listen, learn, and act. Until next time, stay curious, stay compassionate, and take care.